brief about the webinar first?
Yes, sure.
Okay, ma'am. A very good afternoon, evening to everyone present here. Welcome to today's webinar on setting up your dental practice in a new city. Whether you are expecting a fresh start or expanding, we are here to cover key steps that will help you understand the local regulations, finding the right locations, and attracting patients. We are excited to have a speaker with us today, Dr. Manisha, a graduate from TKBC MUHS University. She opened her practice in the year 2020 despite the challenges of COVID 19. Last year, she moved to Ahmedabad while her team continues to manage her clinics in Maharashtra. Dr. Manisha is a dedicated dentist and continues learning and plans to pursue further endeavors in the future. Thank you, Dr. Manisha, for joining here today. And we are here sitting ready to help you guide us. Ma'am, you're on mute.
Yeah. Thank you everyone for being here and thank you for the lovely introduction. And especially, I understand it's Sunday afternoon and still all of you all are here. So I'm really excited to be with you all, and I'm sure you all are going to have at least a few key takeaways so that it benefits you. So without any further ado, I would like to begin. Hello, is it visible?
Yes, ma'am.
Yeah. Okay. Just a second. Yeah, am I audible?
Yes, ma'am.
Okay. So, hello everyone. Excited to have you here as we dive into what it really takes to build a successful dental practice from zero to thriving in a completely new city. Having set up three private clinics and treated over 5,000 plus patients, I know firsthand how challenging but also how rewarding this journey can be. Let's break it down into your key areas that can make or break your success. So, the topic for my webinar is From Scratch to Success Setting Up Your Dental Practice in a New City. You know what? So many a times, newly fresh graduates today come to me and ask me that we are just graduated, we've just completed our internship, and should we go for an MDS? Should we start up a clinic? Should we work somewhere? So the first thing that I tell them is your skills. They are more just than a diploma. So when you're in your college, you're just learning dentistry, but you actually become a dentist only when you step out of college and you actually start practicing in a clinic. Because apart from just knowing the clinical skills, there is a lot more that goes into managing and having a dental clinic. It literally takes a village to deliver the best dental care to your patients. So why should you listen to this webinar? Now you've aced your exam, let's plan to ace the real world too: business, patients, and profits. Let's get into it. The first thing that's really important before even starting this webinar that I'm going to tell you is, if you're a dentist, either if you decide to practice in your own private clinic or a job somewhere or whatever you decide, I would like to tell you, it's a must have. You should have a LinkedIn page. You should have your own Instagram profile, because if you're not present digitally, you're not present anywhere in today's time and era. Apart from that, if you're planning to set up your own dental practice, another important thing would be your Google My Business page. We are going to talk all about it in detail in the further slides, but these three key takeaways would be your LinkedIn, your Instagram, and your Google My Business page. You won't believe I get 90% of my clients through digital platforms. So yeah, times are changing, and so do we. We do have to change with that. So let's get into it. The first thing that I would like to talk about is strategic location selection. So finding the right location is like finding the perfect house. It's got to have great visibility, great accessibility, and the right neighbors. As you all know, footfall matters, because without footfall, you can't really do anything. So, being near residential areas, schools, or commercial hubs can give you a strategy, can give you a steady patient flow. A clinic hidden in a tiny lane, quiet lane is not really ideal. So the visibility should be there. So it should be, maybe you can think of having it around a bank or a supermart, or let me tell the Hindi for that, a char rasta. Basically, it should be visible from vertical and horizontal directions. Your board should be placed such that it's visible, and you should, like, the second point to keep in mind is that know your competition. Too many dentists in one area, yes, of course, but it's going to be a tough market unless you niche down and differentiate yourself. So let's talk about affordability. When you first start looking for a space, you have to pay a lot of course you're going to be leasing it initially, so your rent should not eat up 50% of your revenue. You should take in mind that when you open up first, it's you're going to have a waiting period of at least 6 to 8 months, maybe a year. So आपके पास इतनी capacity होनी चाहिए that you can sustain for a year, 6 to 8 months tops year. So your rent shouldn't eat 50% of your revenue, because there are other overheads that are going to come in place, and we're going to be talking all about those. And yes, where I practice in my single lane, there are 350 plus dentists, but I'm not afraid of competition, because like I told you, you niche down and differentiate yourself. Now, how do I differentiate myself is the patient care, patient education, and everything on my digital platforms, and a regular follow-up protocol. I'm going to be talking about it in my further slides, but yeah, don't worry about the competition. Be the Shah Rukh Khan of dentistry there is, because um, competition and saturation comes with every profession, and if we get scared of it and do not even start, then we're not going to reach anywhere. Let's go on to the next slide. Let's talk budgeting. So also, other thing that I would like to talk about in the previous slide, I'm sorry, I just had to add that prime locations also come with prime rents. Like, you have to think that, is the extra cost worth it? I mean, you can also take a clinic in a slightly offbeat but a well marketed location. So a few months ago, when I was starting up my own dental practice in Ahmedabad, I happened to watch a TED talk, and that's where I learned this, and I'm gonna pass it on to you. Is that whenever you start a new business, so before starting, if you start investing in all the kind of fancy interiors, or maybe a coffee machine or flashy LED boards, you're already going in minus. So what you can do is, learn what's need to have and what's must have. So we're going to be talking about the budgeting and the smart spending smart wins. So prioritize essential drills over fancy LED signage, because there are going to be hidden costs like licenses, staff salaries, maintenance, the bio, of course we always come with material costs, equipment costs, and also the waste management, everything, also the deposits for the new place. Also, you're going to be needing some plumbing, some tweaks here and there with the machinery inventory. So there are going to be a lot of essential hidden costs. So you have to prioritize. Here's a pie chart on my slide. If you want, you can take a screenshot of this slide. So this is how I divide my budget. 40% goes for equipment, 30% goes for rent, 10% is kept for emergencies, and 20% for marketing. Yes, if you do not have a marketing budget today, you can't stand, because now your clinic not only requires good skill set, but it also requires aggressive marketing. Sorry, yeah. So we all dream of a high-end tech-savvy clinic. But when you're starting afresh, you need to be strategic about where your money goes. Like I was saying, there is must-haves versus nice-to-haves. A high-quality chair, sterilization unit, and a basic diagnostic tools, yes, definitely must have. You have to invest on a high quality chair, a sterilization unit, and your tools. What are these are the must haves, but a luxury coffee machine, a wall sized aquarium, no, maybe you can wait for it later. Of course, when I started, I'm going to tell you a story of how it all began. So let's talk about brand new versus pre-owned equipment. Now, some things like hand pieces should always be bought new, but items like dental chair or X-ray machine, you can also go for pre-owned, and they can be a great cost-saving option. So when I started, I got a second-hand chair. My first chair was a second-hand chair, which costed me around 50,000. Now, if you go to buy a new chair, it is going to start around 80,000 to 1 lakh and more. That's the range, starting range, and it goes on to a lot more, of course. But in the beginning, I did not have that much, did not have those kind of funds. So I decided to go with the second hand chair. I got it repaired, and that's how I began. So pre owned can also be a great cost saving option. Also, second thing that I would like to tell you all is avoid the shiny object trap. I mean, fancy new gadgets won't bring in patients if your fundamentals like patient experience and marketing aren't in place. Also, the second thing that I would like to tell is when I started the clinic, I negotiated on a lot of discounts. For example, I got my RVG and my material and everything during November, which is Diwali sale, and that helped me save a lot of money. And I also ordered from Dent Cart and Dental Cart and Dent Ganga, so they always have these discounts. Also, I curated a list of local dealers and negotiated the entire package with them. So you can, if you're buying a lot of things from a single person, you can negotiate with the suppliers and you can ask them for a bulk discount. And you can also partner up with the local lab to reduce your initial investment. um, also there are some high ticket items like, for example, the endomotor, the RVG, apex locator. You need those things, but for example, laser or a packing device, you can buy those things later as and when you develop your practice. So for all of you all attending the webinar today, I have curated a PDF for need to have and must to have. So what you can do is, after the webinar, just DM me on Instagram saying PDF, and I'll be giving you the link to the PDF all for free. And you can go through on how I decided what's need to have and what's must to have. And you can have the list, and then you can just start buying right away. So next is a building patient base from zero. No patients equals no practice. So this is the biggest challenge every new clinic faces. You've got the setup, but now you need the actual patients in your chair. So regular like updating of leveraging and updating with the local connections, like joining local WhatsApp groups, community clubs, and business networks. A casual connection can lead to your first referral. You won't believe, when I started, I literally used to have a pamphlet, like a bunch of pamphlets in my hand, and walk down the street going from medical to medical, talking to the medical person, giving them the pamphlet and asking them to send patients. So yeah, I have done that. Now, luckily, we are in the era of social media. So now what you can do is have a a LinkedIn profile. That's a must, because as doctors, we think we don't need a LinkedIn because we're not doing a job. But you do need a LinkedIn. You won't believe, I have targeted multiple FMR cases abroad through my LinkedIn. Yes, that is possible. I am doing it, and so can you. Second is Google My Business for your clinic. And don't just, the most important mistake we all do is we just make a Google My Business and we forget about it. You have to keep maintaining and updating your Google My Business. So what I have done in my clinic is I have put up a barcode which has my Instagram, and another barcode which has my LinkedIn, and another barcode which has my Google My Business. So people just can scan, they can go to my Google My Business and put up reviews. Also, the second thing that I do to retain the patient is, like, patients aren't born, they are earned. What I do different to fall apart from the crowd is I have a strict follow-up protocol with my patients. Also, I have curated dental oral kits for my patients with my branding on it. And after we give it to FMR patients so that they have something to remember us by. We have an electronic toothbrush in that, a water flosser, and some other oral care needs in packed in a one package, and I give those to my patients so that they remember me. Second thing that I do is I take up lot of dental camps and community service programs so that people get to know that I exist and where my clinic is. Apart from that, I also have a very active social media where I post smiles and not just drills. Instagram reels are greater than pamphlets in the current time and era. Also, like I told you, I have a follow-up protocol that I have built for my patients. So every time I have a surgical extraction, or even a normal extraction, or a root canal, or a crown, whatever it is, after a week or 15 days, someone from my team will call my patient, ask them how's the healing, ask them if they are facing any problems, ask them if they are having any difficulties. And even when I complete my treatment with my patient, I tell them that you have to visit me for a follow up, which is a must. And that has helped me go a long way because it adds a personal touch, not just in my current practice, but in all my three practices. These follow up protocols are in place. You have to develop that system since day one. Show your patients you really care for them, because personal care goes a long way, and one happy patient equals 10 new ones. Trust me, I'm saying this through experience. Also, apart from this, I collaborate with a lot of local hospitals, build a referral system. See, the organic referral system, the best one is from patient to patient, the mouth publicity that we all talk about. But that, let's be honest, that takes time. So how do you get new patients? Through your Instagram, through your LinkedIn, through your Google My Business, through your SEO on the Google My Business. Yes, search engine optimization. You need to keep updating. A few tips, very brilliant tips that work for me, I'm going to share with y'all, and these are gold, trust me. So whenever you post on your Google My Business, make sure that you are adding the geo tag. What that does is optimizes things and helps without even spending any money. You can do your SEO optimization. So you have to have the Google geo tag on your pictures. Post some patient videos or procedure videos, or some like reviews and other reviews that people will be putting up. Apart from that, keep looking at your Google My Business. Ask people to review you and write things that the treatments they have undergone. And don't just forget about your Google My Business. Keep updating pictures with the Google geolocation. And if you are hiring a marketing agency for your marketing, make sure that वहां पे वो लोग फ्री एड्स चलाते हैं. तो पहले ऐसा था, people would think with free ads many will get a lot of traction, but that's not true. What you can do is not just, it should be relatable to your profession. The free ads and everything should be local, about your city, and things related to dentistry. If you are a dental page and if you are having free ads about a fashion page, that's not how it works. So these are a few points about Google My Business that work well for me. And yeah, let's move on to the next topic. Next slide is so like we talked about that your Google My Business, post regularly on social media. So I divide my content into three parts, like educational content, personal, and engaging content. It should be 10% should be humor, 50% my focus is on patient education, and then 5% is my personal content. So that's what I do. Word of mouth marketing still wins. You can offer launch discounts, free consultation, referral perks, and the first few patients can become your biggest promoters. Also, another sorry, I forgot to tell this in this slide, but another thing that is a pro tip is that, run a free friends and family open day. Invite them for a tour. Like, give them a package, like, give them some discounts, some offers, because initially your friends and family are going to be the one that are going to be coming towards you. And so you can't just treat everyone for free. What happens is, it's a tricky slope when you're navigating how to charge from friends and family. So what I did in 2015, I attended a conference, and that's where I was listening to this talk. And the point I picked up from that, and I still use it and follow it, and it has helped me a lot, is that have a fixed friends and family discount. Like for me, I have a 10% fixed friends and family discount. Chahe fir wo friend ho, family ho, whoever it is, 10% fixed family friends and family discount, so that you don't have to think every time you're working with a friend or a family. So that's how I do things. Next, managing challenges. So, like, moving to a new city and starting from a scratch isn't just about clinical skills, it's a lot about mental toughness. Patience is key. It takes time to build a reputation. The first 6 to 12 months can feel slow, but consistency wins. Consistently posting on Instagram, consistently carrying out camps, and lot of networking. Yes, you can all go to my Instagram and see my posts and watch how aggressively I network, because without building a network, without building a referral system with other healthcare professionals, there is no way you can stand out from other clinics in your crowd. Also, building interpersonal relationships with other healthcare professionals, upgrading your LinkedIn, attending relevant events, and upgrading your tech and upgrading your skills is a must do. So, hiring. These are few tips that I am going to give you how to manage the challenges. First comes with hiring. Hire a staff who smiles more than your patients, because of course a smiling person always welcomes and greets people, and it's always nice to have. Second is, it's a slow start. Of course, remember, Rome wasn't built in a day, but it was built. So you are going to build your practice if you follow smart tips, and you are consistent with what you're doing. Of course, after a point of 4 months, 5 months, 6 months, you're going to realize that still I'm not getting patients. Still, it is a slow start. And you're going to have a burnout. Trust me, we all have it. So remember, self-care isn't selfish. You can't fix teeth with shaky hands. So fix yourself, take that break, have some time for yourself, at least have an hour to yourself every day where you're de-stressing and doing everything that you love doing. And remember that Rome wasn't built in a day, and neither is your Google rating. It's going to take time. So yes, stay in there, hang in there, find a mentor or a peer group in your city, having someone to share insights which can make your journey much smoother, because there are going to be a lot of times when you feel like giving up, and having your friends and family around can really help you. And burnout is real, trust me. Running a practice is more than just dentistry. It's marketing, it's finances, it's HR, it's operations. It's like, so you have to learn how to delegate, automate, and take breaks. Very important, take breaks. Moving on, like I told you, self-care is greater than 100 patients. Self-care is empowerment. So yeah. So what's the secret sauce to opening up your own clinic? Starting your new practice in a new city is very scary, but it's very exciting, and it's absolutely worth it. So your skills are your foundation. Of course, what you learn in dental school is very important, but your strategy, your branding, your resilience will define your success. In today's time, your Google My Business, your LinkedIn, your Instagram is going to get you more followers than any pamphlets or newspaper ads. And I'm telling this by experience. So, not one trick works for all. Marketing is a lifelong learning. So I have tried and tested many things. For example, I have done newspaper ads, I have done pamphlets, I have done camps, I have done events, I've taken dental quiz on Mother's Day, Women's Day. I have done it all, and I have done Instagram, LinkedIn, Google My Business. But what works best for my clinic, my strategy may not work best for you and your location. So you need to understand everything and then decide, trial and error, and try and then decide what works best for you. But Instagram, LinkedIn, and Google My Business are a must have. There is no win-win unless you have all of these three in place and you upgrade yourself digitally. So location must be accessible, not inception level hard to find. Reviews should be there. You should ask your patient for that Google love. Adaptability as trends change, root canals don't, but your marketing should. That's what I'm telling you. Your marketing technique should change as in how the trends change. But again, Google My Business, LinkedIn, and your Instagram is a no drop. You have to have it in place. Don't just drill teeth, drill success. So, if you have any questions, drop them in the chat. I'd love to make this interactive and share and more insights based on my own journey. Before I wrap this whole thing on, I wanted to tell you that the thing that got me this far is two, three tips that I'm going to be giving y'all is, one is record your cases, document your cases. Dental photography is very important. Invest in a good camera, in a tripod, maybe a mic, maybe a flashlight. Invest in that. Have a proper documentation of your cases for you to document it and show it, because you need to show the before afters for convincing those patients, those high revenue generating patients. So I started documenting my cases since 2015. That is my first BDS. Since that year, from the first tooth carving I made to the first amalgam cavity I filled to today, I have all my before afters, and documenting them, keeping them ready in a file, and it's very important. Have that. Second, Google My Business. Again, I know I'm saying it again and again, but yes, Google My Business. Reviews, upgrading your Instagram, having patient focused content, and patient follow-ups and empathy for your patients. Skill and upgrade, upskill and upgrade every year. So what I do is every year I learn and take up at least two new skill sets or two new courses or two new certificate courses, and that has gotten me a long way. So upgrade, learn, have Google My Business, LinkedIn, Instagram, everything in place, patient documentation. All of these things nobody's going to teach you, because you're going to be learning how to do a root canal, or how to make a crown, or like everything. You're going to be learning all the dental aspect of dentistry in college, but the moment you get out, these are the real world challenges you're going to face, and these are the tips and tricks that are going to help you go a long way. So these were my personal insights, and I hope you all had a great time. Now I would like for everyone, if you all have questions, please drop by in the chat, and please follow me on Instagram and my LinkedIn. Let's connect. I always love talking to new people and sharing insights, maybe learning from y'all too. And yeah, let's connect on Instagram and LinkedIn. Here's my ID, and come say hi. Just put the word PDF and I'll send you the need to have and must to have. It's lovely being here today, and yeah, I'm waiting for your questions. Thank you, everyone. So yeah, I think I have gotten a few questions is which mic I use for my videos. So I have a very basic one. I believe in saving a lot of budget on all this and getting the best out of like it. So you won't believe, I ordered this through Blinkit. It's only for $700, people. Yes, invest. It's by a brand called Potronics. So only 700 rupees, get this and it will sort you out. It's the best there is. Of course, there are expensive ones, but I think to solve our purpose, this is fine. It works well. So yeah. Also, I have a question by Adiba. Hello, Adiba. You're asking what should be the minimum budget for a new dental clinic. So, budget is a very personal thing, and I wanted to not take up any loans and EMIs and the added stress that comes to it. So, when I started, मैंने 50,000 का second hand setup खरीदा, and I did not even think, and I was like, let's just start. I got my instruments, I got my things in place, and from that day onwards, I have never looked back. And it's been an amazing journey, touch wood. So, maybe you can chart out the budget, and like I gave you the pie chart on the slides, you have to think कि आपके पास कितने savings हैं या आपको कैसे किस चीज में what do you want to invest more in. So I always invested in quality instruments. That's a no brainer. You have to get quality instruments. You have to invest in good material. वहां पे आप compromise नहीं कर सकते हैं. Where you can compromise is things like this mic, camera, other fancy things in your clinic like the couch, interior, LED sign of smile please. You don't need all that. You just need your good instruments, good materials, Google My Business, LinkedIn, and your Instagram. I'm saying this again, but yeah, I want to literally hammer all of y'all to have your Google My Business, LinkedIn, and Instagram. It's a must have. So yeah. So budget, I think it's a very private, issue. But if you're facing any problems personally, please reach out to me on Instagram. Tell me what your budget is. Maybe I have friends who have put in 30 lakhs into a clinic. I have friends who have put in 12 lakhs into a clinic. And then there is me who's a bootstrap started like with bare minimum. So it's all up to you. You come up to me on Instagram and we can discuss more about this. So after how much time you can say that your clinic was well established? Well, I'm going to give an amazing answer for this, because as doctors, as professionals, we always say, I am practicing. We never say I am accomplished. I think it'll take me a lifetime to get there, because as and when I achieve one thing, I want the next thing. So I am practicing, and we are all practicing to get there. And I think for doctors, upgrading, updating, and we always say, okay, we always ask someone, where are you practicing? Okay, they say, I am practicing here, because we are all practicing. So I don't think you can say that I am well established, but it's how and when you decide to be well established. According to me, I will be well established maybe never, because I want to keep growing, keep learning. And I love dentistry. I absolutely love what I do. I love talking to my patients, and I don't think I'm ever going to stop doing dentistry, because nowadays I see so many people after BDS, they're like going into these non-clinical roles, quitting dentistry because they are all scared to set up their own practice. I understand it's scary. I do. And there's nothing wrong or nothing against people going into non-clinicals. Of course, I respect them. They have their own reasons. Of course, that's a good field too. But me, I'm through and through a clinical dentist, and I am here to talk only about that. So, and yeah, it just takes a while. It's scary, but it is rewarding. It is definitely. I tell you, after 1 year, after 1.5 years, after do all those things, build the referral, build your patient base, and you have no looking back after that. So yeah. Okay. Do free dental checkup really works? Okay, thank you, Arvind, because this is a very interesting question. So, आपका फ्री डेंटल चेकअप करने का जो पर्पस है ना, वो ये नहीं है कि आप पेशेंट लेके आओ क्लिनिक में, क्योंकि कोई नहीं आएगा. आई एम टेलिंग यू दिस आफ्टर लाइक 50 dental camps. Okay, so the whole purpose of doing your camps is visibility, making people understand I exist. I am new in the city. This is my clinic. I exist. And hammering them, having their numbers. I have a broadcast channel. Every dental checkup I do, I take numbers of people, I add them to a broadcast channel, and I bombard them with my content. And literally, and फिर उनको कभी कहीं याद आता है कि oh, हाँ हमने ये चेकअप करवाया था, let me, my relative is having an issue, let me send him to this doctor, she was very nice. So that's how it works. It's a long shot, of course it's a very long shot, but it works. But आप सोचोगे कि also what I do is after doing the dental camp I get all the numbers of people, and जहाँ पे कोई FMR हो या crown and bridge हो या root canal हो या कुछ बड़ा procedure हो, I put a star on it. And after 15 days, I call the person to remind them. If they want to come, they come. If they don't want to come, then they don't come. So 5% crowd aata hai. Yes, after you give them a follow up, like if you give them a follow up call. So when you won't believe, when I began, I was only the person calling, I'm so and so from, like I'm from the team, but it was me who was calling. So initially you have to do those things. And yeah. And okay, so that's how it works. And what is the better way to boost reels or Instagram ads? Okay, so neither. Okay, I don't boost my reels and I don't do Instagram ads. We do meta ads. So through Facebook and performance marketing, that's a whole different ball game. And boost ads and Instagram boost reels and Instagram ads will only give you followers. Now what's your goal? My goal from Instagram is getting patients. I don't want followers. 1000 लोग मुझे फॉलो करेंगे तो वो मेरे क्लिनिक आएंगे, जरूरी नहीं है. So what I do is, for I have made so much educational patient content, and what I do is whenever my patient has a doubt on flossing, I just forward them the reel. So it becomes easier for patient education. That's my uh, like my purpose of having an Instagram is to build a digital presence of my clinic, not myself. So I use it for my patients. I send the links to my patients, and I only focus on patient education for now. But dhire dhire I'm like delving into mentoring children, like mentoring interns, mentoring dental professionals to start up their own practice. So I'm getting into that I'm moving there little by little. So boost reel and Instagram ads won't help you, sorry, but meta ads, performance marketing, SEO, Google My Business, having a website, this is going to help you a lot. So yeah. Broadcast channel on WhatsApp, right? Yeah. So I have a broadcast, you don't call it a channel, you just have a WhatsApp broadcast where you can add people and you can share your like patient stuff and patient education things, and any offers that your clinic might be running. It's very old school, I know, but it works for me. So yeah, WhatsApp broadcast, that's what I was saying. And okay, when patients say sirf baat karni hai doctor se, how to handle that? Okay, so what I do is you have a staff in the reception. If the patient says I want to just talk to the doctor, the staff will nicely smile and tell the patient that, you know, हमारे यहाँ एक protocol है. This is where you fill this form, we get your details, we understand you, and then you can go and talk to the doctor. Also, this works, but if you do not have a staff initially, what you can do is get the patient inside. First thing, you greet them and you tell them that this is a form, this is a protocol that we follow in our clinic. You fill the form, and then we can talk. So then you can tell them beforehand that these are my OPD charges, and let's talk. I'll give you a consultation only after you fill the form and pay my OPD charges, even if you don't want to get it checked. So yeah, that happens to the best of us initially. Yes, it does happen, and you have to never get agitated or angry with the patient, because your tongue is really important. अगर आप गुस्सा करोगे, आप मना कर दोगे ना, तो 50 और क्लिनिक है उसी लाइन में जहां वो जाएंगे और ट्रीटमेंट भी करवाएंगे. So your behavior, your empathy, your patient care is very important. But that doesn't mean you just give and give. Like, you have to have that boundary, and that will only and only come after experience. So yeah, because when you're first graduated, when you're first starting a dental clinic, you all look very young. And it's so what I did, I would wear my white coat and I would try to look elder, like, so that on purpose, so that people don't intimidate me. That's the trick I used. And yeah, I do meta ads. So if you want to know more about that, please get in touch with me on Instagram, and we can, it's a whole new topic. Maybe I can also have a webinar webinar on it. If these people ask me again, we can do a webinar on Google My Business and Meta Ads and performance marketing and SEO, whatever you want. So we can do that too, because it's a very vast topic. And yeah, so Arvind asked me that should we discuss the amount of payment or let the receptionist handle. So in my clinic, what I do is, this I have done since day one. First, the patient comes, उसी दिन मैं treatment नहीं start करती. Why? I want to build a patient rapport, a patient connection. So the patient comes. After that, we check up, we do the X-rays, we do the diagnostic things, and I sit with the patient. I make the patient understand. I make them understand the treatment plan. I also give WhatsApp treatment plans to the patients, and then ask them to decide what they want to get, and then come back to me. And only that time I discuss the payment, because sometimes your receptionist can't answer all the questions regarding the quality and everything. If you're trained, so back home in my both other practices, my receptionist handles it because I've trained her over a period of time. But initially in my current Ahmedabad clinic, I'm handling it on my own till I get the patient trust, till I train my receptionist to have that much of knowledge, and then to make people understand why they are paying for what and how much are they paying and what they are getting. So yeah, I hope that answers your question. Next is Janvi Pujari. She says that I am from private college and I have to look for patients. Okay. So are you asking, if I'm not sure if you're asking for patients for exam or patients for clinic or what? I Can you please specify so that? Okay. So for do you want to look for patients for okay, you want to ask how to initiate conversation. So when I was in a rural college, and what we used to do is we used to, a group of friends, like suppose 4 people or 5 people, your posting mates, we used to go house to house and talk to people. There is no other easier way than this. This is what you do. And yeah, there is no better way to do this. But to get patients for your exam, yes. But to get patients for your clinic and to get patients for your exam are 2 different things. Today we have spoken about how to get patients for your clinic, not about your exam and your college. So that you have to go house to house. There is no better way to do it. Yeah. Also okay, but how to initiate the conversation? So you can say, okay, so I'm from the college nearby, and I am a dentist, and we are looking to provide free treatments to y'all, and yeah, that's how you go about it, and there is no easy way to do it. I understand why you're asking this question, because I think maybe you're an introvert and you're facing a problem in people skills. So I would really advise you to go to some events, maybe a book club, or maybe any events that are happening near around your college, so that you become a little bit outspoken, because people skills develop karna bahut zaruri hai. This profession requires you to be an extrovert. Look at me, I was a shy, timid girl and now I'm giving a webinar to like 30 people. So you have to build those people skills and interpersonal relationships, and it'll happen over time. I know it's scary. I know you are very shy to just go up to someone and tell them, Karo, I want to see your teeth and I want to take you to the college. It doesn't work like that. You have to tell them that you're a dentist, you're looking for patients to provide free treatment, and you promise them that, of course, not fake promises, but you assure them that you're going to give them a good treatment and there's nothing to worry about, and they're going to be helping you in a process of your exam. You be transparent, you be open about things. Nothing should be hidden from the patient. That's how I work. Even in my clinic, if I break a file, I break a file. It happens to the best of us. I'm going to tell the patient, I'm going to make the patient understand, I'm going to make sure the patient trusts me and understands that he is in good hands, and we are going to take care of it. Yes, that's how it works. Be open, be transparent, and be true to your words. Don't overcommit and underdeliver. You can not build anything like this. Do not overcommit. Do not. Also, I have seen dentists doing this. मैं आपको warranty दे रहा हूँ, मैं आपको guarantee दे रहा हूँ. I never ever use these words. Warranty and guarantee नहीं होता है dental care में. This is not how you do things. You really need to polish your language. You need to polish your words. You need to understand how to talk. because you cannot overcommit and under deliver and make false promises to the patient. It will ruin your reputation. So yeah. So Dr. Shweta asks me, do Google Ads work? So performance marketing is a whole vast topic, and yes, it definitely works, but it takes time. It's going to take repeated, recurrent. It's you're building your brand, so it takes a long time, 6 months to a year, but you have to get it done from someone who really knows what they're doing. And yes, they definitely work. At least for me they've worked, but you can't have results in a single ad. It's going to, your marketing budget should be such that initial days mein aapka marketing budget nahi hoga Google Ads jitna. It will be only 1,000 rupees per day or whatever. But dheere dheere, as and when you build your practice, you start getting full mark cases, you start getting high revenue based cases. You can, what I do is I set up a extra budget and I keep it aside for my marketing, for my Google Ads, and eventually it works. It takes 6 to 8 months, a year tops, to for Google Ads to actually show you any results. But not just Google Ads. Agar aapka Google My Business is dead, if you've just made a page, put up your map location, put up everything, and you've not like not looked at it in a year, no, it's not going to work. You have to keep updating it. You have to interact with your patients. You have to interact with the reviews that people have put. You have to show some activity. You have to put geolocation on any picture you put, so that people understand. I would request and urge all of you to go to my LinkedIn and see my LinkedIn and how I keep updating it regularly. Go to my Google My Business, or maybe not mine, any other dentist in your locality who you think is your inspiration. Go to their Google My Business, study the trends, study everything. And it's not that you have to hire a marketing professional to do it. It's not rocket science. Come on, we are all educated doctors. If we study, we observe, we learn the trends. Initially, when you have started a clinic, you have a lot of time at your hand. Not necessarily hire an agency, marketing agency, to do it. You can learn. There are free courses online, on YouTube, on LinkedIn, videos, reels, everywhere. Learn these things. These skills are a must. Another must have skill is Canva. Yes, please learn Canva. Learn how to do the basic graphics. It is easy. It is not rocket science. We have all done opaque diagrams. We have all done, dentistry is like art, dental engineering. What do we say? It's so much of art and creativity. Put that to use. These skills are transferable. Don't forget that. You have time at your hand. Maybe if you're in college, if you're a resident, if you have time, you have 1 hour, learn Canva. Go to YouTube, learn Canva, learn how to start your own Google My Business, learn how to, what are the like performance marketing tools, learn AI. I know AI is the buzzword nowadays, but yeah, you can have so many AI tools. Of course, AI can't replace you, but you can use them as tools to help you to make these posts, make patient education content, make your lot of things easier. So upgrade and learn these tiny little things. Do these free marketing courses available online. It's all there. We are living in this era. It's all available in a single click. So learn it, do it, put in the time, put in the effort. Instead of scrolling reels on your Instagram, go put your time to some use and learn these basic skills. So how to grow as a general dentist and not as a specialist? Okay, so I am proudly just a general dentist, very proud. And yes, one thing I would say, that I do respect specialities. As and when I need help, I do contact. When I was starting the clinic, I had all the specialists. I work with the team. I believe in team practice. I have an endodontist, I have an oral surgeon, I have an implantologist. I'm not going to learn something in a 2-day course and start doing it on my own. No, that is a no do. Of course not. Believe in team practice. Even if you decide कि मुझे BDS के बाद MDS नहीं करना है, it's not end of the life. You can upgrade. You can do basic endodontic courses. You can do crown preps. You can do everything that a general dentist can do. You can polish your skills. Take those extracted, sit and practice, learn those courses, upgrade yourself, and believe in team practice. As and when, once, so diagnosis and case selection is very important when you're a general dentist. If you are seeing there is a case of disimpaction, and if you feel that you cannot do it, don't attempt it. हमको experiment नहीं करना है, हम internship में नहीं है. We are in a private practice. Do not experiment. If you feel मेरे बस का नहीं है, simply schedule an appointment, call up your oral surgeon, get it done, and finish off. So I'm not against MDS. Of course, I want to do it at some point in my life. I will be doing it, but currently I'm not. I'm just handling my practices and I'm upgrading. I'm doing multiple courses. Recently, I did a photography course by Mayur Davda. Before that, I went to the New York Symposium. I heard the talk on veneers. I have done my veneer prep course. So I keep upgrading, and I believe in team practice. I call up specialists and we work together as a team, and that's how it works. So the next I'm planning to do is a laser course. So I keep upgrading. I use that money, some for marketing, some for upgrading, some for the clinic, and then kuch bachta hi nahi mere liye. So yeah, jokes apart, but that's how you do when you start. So okay, so I'm a second year PG student at the Department of Orthodontics and planning to set up my clinic after completion. Yeah, you should do both. Why just stick to ortho patients? I mean, you're a dentist, and it's a personal choice. I believe that if you देखो और एक important चीज जो मैंने सीखी है is that आपकी clinic में ना multi speciality लगा दो. The clinic name में multi speciality लगा दो. The moment you choose multi speciality, people think and know it's clear enough that you're a team practice. That means आपके यहाँ endo भी होता है, implant भी होता है, ortho भी होता है. And if you can do so much, why just stick to orthodontics? I mean, if you really love and are passionate about orthodontics so much that you only want to do that, that's a personal choice. But orthodontics is incomplete without extractions, without scaling, without other things. Any specialty is incomplete without general dentistry. So, my friend, it's always going to be a team practice. And now, many cases and treatments require multidisciplinary treatments. It is not with ortho you have to combine veneers, sometimes you have to combine mini implants, you have to combine a lot of other specialties treatments and then do it. So without general dentistry, only exclusively ortho nahi ho sakta. You have to club everything together, and it is really a personal choice. But if you put up multi speciality and then start doing everything, higher specialties, or maybe in future जब आप clinic खोलोगे ना, आपको ये सोचना है कि 5 साल बाद I want to scale. एक का 2 clinic बनाना है, 2 का 3, 3 का 6, maybe what not. There is it's endless possibilities. So you have to think initially only कि the name I'm choosing for my clinic, is it scalable? Like for example, I know someone whose clinic name is so difficult to pronounce that people can't refer other people. वो नाम ही नहीं बोल पा रहे. So make sure according to your location, according to your vernacular language, you choose a name. Choosing the name for the clinic, choosing the location for the clinic are all these important steps that are going to shape your next 5 to 10 years. You can't keep changing your brand. You can't keep changing your name. You have to have the same logo through and through. You have to have the same name through and through if you're going to scale your clinic. So initially, जैसे Pranal is asking me कि should I only do orthodontics or general practice? You need to think that you need to really think that how do you want to scale your clinic in 4 years or 5 years. So that's what will help you. The trajectory of thought will help you key how do you want to scale it, and then you can decide what you want to stick with. And it's really a personal choice. So I hope I have given a few insights for you and it was helpful.
I guess Neha is having a doubt.
Yeah, so how did you make the planning of growth when you first set your clinic? Yeah. So, what since my first PDS, what I used to do is I used to look at मैं 2015 की बात कर रही हूँ, जब कोई रील्स बनाता भी नहीं था, जब कोई एग्जिस्ट भी नहीं करता था ये सब. आई यूज्ड टू मेक वीडियोस, ओके, पेशेंट एजुकेशन वीडियोस. माय एंटायर कॉलेज वुड लाफ एट मी कि ये तो पागल है, ये क्या कर रही है. बट टुडे सी द होल वर्ल्ड इज मेकिंग रील्स. सो my point in saying this is that you do not have to worry about planning the growth. It's going to be organic and you're going to learn so many things along the way. It's going to be trial and error. Agar one marketing strategy is working for me, it will not necessarily work for you. All these marketing coaches on Instagram who are asking you to pay money for their courses and tell you, I'll give you one simple trick and you'll scale your clinic. No, my friend, it's not going to happen. It is personal. Like clinic to clinic, city to city, it's going to differ. Like for example, I would like to tell you, for both my clinics back home, I do not require any marketing. And for my clinic in Ahmedabad, I require aggressive marketing because it's a tier 1 city, and back home it's a tier 2 city. So city wise, location wise, it's going to differ. My current clinic is above 2 banks. Anyone, whenever people come to the bank, they look upwards and they see my board, and maybe sometimes they realize, chalo, check up karwa lete. So even that is working in my favor. So I don't know where you're going to set up your clinic, or what location it is going to be, or what city is going to be. So how can I promise you ki, this marketing technique will work for you? No. All I can give you is tools and insights that have worked for me, that have helped me, that have been a game changer for me. And that's what I'm here to tell you. And I had my Google My Business very early on in my career. I had my professional Instagram to maine abhi chalu kiya hai, but I used to post on my personal Instagram, which was a private account, but recently I've gone public with the other account. So yeah, this I wish I would have done this before, but I did not. So yeah, that's the mistake I made, and that's why I'm telling you, make your Instagram. And LinkedIn, yeah, LinkedIn I've had since a very, very, very young time. Before, I think 2015, first year BDS, I started my LinkedIn. First year BDS, I was attending conferences which my PGs were attending, and people were like, why are you coming? I'm like, no, I want to see, I want to learn, I want to see what's out there. And in my third BDS, I started doing root canal on extracted. In my final BDS, I told my HOD that, you know what, you take the Viva and teach me how teeth whitening is done. I'll give you the Viva, you teach me, I want to learn. You have to go to your teachers, you have to go to your mentors, you have to tell them you're willing to learn. The will and the thirst to learn is like degrading day by day. People don't want to learn. If you have a junior dentist, I don't have an associate dentist, I only work. So when I see these junior dentists at other clinics, they're like, hum suction nahi pakdenge, हम ये नहीं करेंगे, हम वो नहीं करेंगे. See, I understand you're a dentist, but आपने dentistry पढ़ी है और कॉलेज से आप dentistry पढ़ के बाहर आए. You're not a dentist. You will become a dentist once you start practicing. आप suction hold करोगे ना जब, तब मैं initially 3-4 साल suction ही hold किया है. After like 2016-17, I joined a clinic after college. I used to hold the suction. Suction hold करके जो आप observe करोगे ना, dentist ने rest कैसा किया है, the little things that you will observe, no textbook, no course in the world will teach you the skills that you will learn by observation. So hold that suction, watch the dentist, mix the alginate, do the assistant work, because there is no way you're going to learn dentistry without actually getting your hands dirty, actually doing all these things. आप सिर्फ book में पढ़ के you can't learn how to do dentistry. Practical, on hand, on field training is really important, and suction hold करके मैंने तो बहुत कुछ सीखा है. So yeah, don't be ashamed of doing all that. Of course, if someone is taking undue advantage of you at work and not treating you well, those are other things. But yeah, do the grunt work and it'll help you in the long way. So where are your other 2 clinics? So I have my 2 other clinics back in Maharashtra, in Kolhapur. Kolhapur is my hometown, and I got married and moved to Ahmedabad. So this is my 3rd clinic. Both my clinics, my teams are managing. So yeah, I hope that answers your question. I visit every now and then. Yeah, and I have hired a team of doctors who works there, and yeah. So any particular app to make reels? Okay, well, to be very honest, like I told you, I started making reels, videos, patient education videos in 2015. So I directly make reels on Instagram. No fancy editing, no fancy nothing. My content is fancy. My words are fancy. My patient education, the things that I'm telling, that's more important. My delivery is more great. My patient skills, people skills are more great. So you need to see what are your plus and minus points. And I don't have the, I don't want to, of course I'm learning, I'm trying to learn how to edit and everything and newer things. And I use Canva, I use CapCut, I use Instagram. These are the 3 things that I use, but you can research and you can use what works best for you. I find it very great to just shoot the reel on the go and then edit it on the go and just post it. With the keywords, of course, keywords are really important, like SEO, search engine optimization, and keywords is really important. So I focus on those aspects rather than the apps of making reel. You can just, now we all have great cameras, great phones. You can just shoot it with your phone and not need to worry about a lot of fancy things. But Yeah, it does make a difference to have polished reels and aesthetically appealing reels, but my target audience and my target is patient education. So what works best for me, that's what I've shared, but you can really choose what your niche is, what works best for you. For me, the way I deliver content, that is my plus, so I work with that in my favor. You can decide what works best for you and decide an app, but I use Instagram, CapCut, and Canva. I hope that answers your question. Yeah. So
I guess Chaplin questions are over.
yeah, thank you everyone for having me, and I hope I have shared my insights and they were helpful. And this is just my personal experience. I am no expert. I'm just a dentist, just like the rest of y'all, who's done things a little bit differently and what has helped her. So, if you can take away anything and it can help you in any way, I would really be glad. And you can reach out to me on my Instagram and on my LinkedIn. Put in the word PDF, and I really want you all to have the must have and need to have dental equipment, and it'll help you a lot. So yeah, get in touch with me, and if you need anything else in future, just tell me we heard a webinar, and just we can just connect, we can just talk. And yeah, all the best for all of you all, and I hope each one of you all has a thriving private practice, and not just one, many more, and all of you all are with successful with a lot of flying colors.
Thank you so much, ma'am.
Thank you so much, ma'am. I guess we can end the webinar, Chaplin.
Yeah, thank you for having me.
Yes, ma'am. It was we are grateful
Just
having
a
you.
small request, can you please share I'll give you the link to my LinkedIn and Instagram. If it would really mean a lot if you can put that in your WhatsApp group, so that whoever wants to get connected, they can just connect over there.
Yes, ma'am. Definitely.
Yeah, thank you so much.
Thank you, ma'am. Thank you, everyone, for joining today.